Well, good afternoon, everybody. I need to stay on time, so I'm going to go ahead and get started. I want to thank the organizers for the honor to be able to present here today, and I just want to say, just being here at the conference has been just wonderful. I learned so much, and this is such a great organization to be part of. So I'm going to talk about compression. What happened with my slides? What's that? Okay. Oh, okay. All right. Well, then, come on in. Yeah, that's right. Okay. All right. So I'm talking about compression in lipedema. And compression in lipedema is poorly understood and poorly implemented. And it's really needed. So it's very important. I'm really lucky to be able to talk about this. I have a disclosure. I have research was supported by Tactile Medical, and actually Koya Medical has just now. And I just want everybody to know I'm happy if any industry wants to help support lipedema research. I'm willing to assist. Let's talk about the benefits of compression therapy. So it helps smooth and reduce lobules and cuffs. It improves mobility. It decreases pain. Compression garments have anti-inflammatory property. Compression decreases edema and leading to decreased limb size. And I'm going to show you some proof on that. Improves venous and lymphatic function, leading to improved skin health and waist clearance, and helps maintain the benefits of MLD, pumps, and surgery. So every treatment we know of for lipedema is really built upon compression. So, if you're going to do a pump or MLD and that to maintain that, any benefit you get from that, you're going to need compression. Similarly, surgery. If you can literally undo some of the benefits received from surgery from not having compression properly and causing reswelling and reaccumulation. So this is just a study by Atan, and he measured pain, and there's two different compression. He did complete decongestive therapy and compression pumps, and both those modalities of compression decreased pain in lipedema ladies. And then this is also by Atan, and leg size decreased with both compression treatments. And this is some of my data from a study on looking at off-the-shelf compression paired with either alone or with compression pumps. And so you can see here in the dark blue is the compression alone. And then this is a limb size reduced at each of the segments we looked at, except actually increased slightly at the hip. Well, and then when done together when done compression on top of pneumatic compression pump, then there was even further decreases in limb size. So just a quick thing about bioimpedance. It uses minute electrical currents, and we're able to determine intracellular and extracellular fluid with that. So the high frequency goes through everything, and then the lower frequency is blocked. It doesn't go through the cells, so that's going to be your extracellular, and then you can add and subtract those. And then you can add and subtract your readings from different these different frequencies and different through different limbs and trunk and get segments of that. And so when we looked at what is going on with compression, we see that there's a decrease in extracellular water, or specifically the extracellular water total body water ratio. And the change may not seem like a lot, basically a change of about 0.007, but that's the same change you see in a normal limb versus a limb with lymphedema. So it's a significant change. And this is just kind of explaining, extracellular water, which I just showed you, it's composed of plasma, interstitial water, and lymph. And so plasma is tightly regulated. So really, when we're seeing those extracellular water changes, we're really talking about interstitial and lymph fluid. So, so there's evidence that there's interstitial edema in lipedema and lymphatic stasis. So this really puts lipedema and lymphedema on a continuum of lymphatic function. And only 70% of women with lipedema wear compression regularly. So, where is the disconnect? Why are not more ladies availing themselves of the benefits of compression? And here, if you look in this study also by McIntyre, you see that that women who wear the compression report feeling supported, reduced pain, improved mobility. I mean, these are great things to experience. And why are not more women getting those benefits? Well, it takes work to get compression to work. In other words, it has to be properly fitted. So everybody in here knows that lipedema ladies have unique shapes. And so you can't, the off-the-shelf stuff often will not fit. And sometimes you try combinations of knee highs and capris to make it work. But even that can be problematic to get properly fitting. And if it's not properly fitting, it can actually be painful or certainly not help, and even possibly make things worse. It has to be the proper strength and material. And there's some misunderstandings about what is adequate strength and what are good compression garments, proper donning. Now, one thing that I want to pose is that you can sneak up on it. So if you sometimes, because lipedema ladies have tender tissues. And so sometimes if you start with a lower compression or just a break-in period, or add a lot of manual work or compression pumps to allow you to decrease the inflammation, to allow you to tolerate it, then you're able to build up and it will give you the support you want. So that's something I want to put out there, because it can be very important and really allow a lot of ladies who have tenderness and aren't able to just go straight into the higher strengths. So what are the strengths that what is medical grade? Okay, it's at least 20 to 30 millimeters of mercury. So is what all the studies are going to tell you is required to get the sort of, to move lymph, to treat the lymphatic stasis, and then it needs to be graduated. And so there's not every garment is going to be graduated. Anything that's not going down at least partly on your foot is likely not truly graduated. And so graduation is basically just a gradient of the compression, so that it's at strongest at the ankle and decreases as it goes up the limb, and that gradient allows for the lymph. It gives a fluid, a pressure gradient for the lymph to flow and the interstitial fluid to flow. So let's dive a little bit into the types of compression. So circular knit is the least expensive. This is, off the shelf usually,
And it is the most likely to bunch up or, get folds, and that creates a tourniquet. So it really has to be properly worn. If you're wearing, that's another thing, if you have certain compression, it gets bunched up, and then you're going to decide, oh, well, compression made me hurt worse. Well, that could just be because it wasn't worn properly. It got a fold in it and created a tourniquet, and then the best compression are going to be your flat knits, because they're not going to fold up, and they're going to best contain the lobules and cuffs. They're going to and they're going to be the most comfortable. However, they're probably the most expensive. They have to be usually custom made, and so they're we'll get to maybe we'll get some better support for wearing the flat knits. Weaves are generally can be more comfortable, but there's quite a few weaves out there that are not medical grade, not graduated. I mean, I hear a lot of ladies who wear BioFlect, and I have nothing against BioFlect. I think it's good, but it's not graduated, and it's not medical grade. And then Velcro appliances, and that can be really helpful. They work great. They have what's called the highest working pressure. So compression works by the working pressure during activity, and then there's a resting pressure between activity. And so the working pressure is really the most important, and these Velcro devices have a great working pressure. However, they come in sections and often can slip or, need adjustments, or sometimes they don't completely cover the leg properly. And then if you get a little blowout around the knee or something like that, then you can, you're basically creating a tourniquet situation again. And so it has to be, there's sort of that's why lymphedema therapists are so key in this, because lymphedema therapists can, help you through these hurdles, because, so it's, okay. Luckily, this was already covered so well earlier, but, the Lymphedema Treatment Act was just passed, and it goes into effect in 2024. It is for people who have a diagnosis of lymphedema, but a large percentage of my ladies with lipedema have secondary lymphedema. And so it will definitely, again, it's only specifically for Medicare, but the other payers often follow suit. And we don't know, or probably won't really affect coverage for lipedema surgery. One last thing, as I leave this great audience here, I want to put a plug for this Lipedema World Alliance. This is a international organization so it's clinicians, researchers, and most importantly, patients. So if you go to the website, and I have some brochures with the website. It's just Lipedema World Alliance. I mean, you can, if you just Google that, you go to the website. You can anybody who's interested in participating, patients included, the audience, everybody in the audience is invited. We'd encourage you to go ahead and do that. So, thank you very much for your attention, and if there's any questions.
We do. We have time for a couple questions. The first question is how is lipedema and lymphedema treated differently in regards to compression and pumping? For a long time, lipedema patients have been given lymphedema treatment, but if our lipedema tissue is the lymphatic obstruction and not damaged lymphatic system like in lymphedema, why does compression work for both?
That is a great question. So, and I have to say, I presented some of the studies on lipedema and compression, but most 98% of all the studies done on compression were done for lymphedema. And so we really do, because we both see fibrosis in both. They both have swelling, edema, etc. We do sort of cross generalize, but we don't exactly know that they obviously are not the same disease, and so. But I can't tell you exactly how our compression recommendations differ, because we honestly just don't know enough about the differences and to intelligently inform recommendations.
Thank you, Dr. Wright.